Good morning, Aleah. Thank you for agreeing to meet with me. To give context to our viewers, can you tell me your full name and your official title?
Sure. My name is Aleah Nestby, and I'm the Director of LGBTQ Services at Cooley Dickinson.
Thank you. So I have a few questions. The first one is, what do you think the biggest challenges are today with healthcare access and the LGBTQ community?
I think the two biggest challenges, one is for people to find a provider that is non-judgmental or non-biased, somebody who will treat them respectfully and affirm their sexual orientation or gender identity. And then the other challenge is finding a provider who understands the clinical sort of ramifications of people being transgender or clinical recommendations for folks in the LGBT community.
Great, great, thank you. And what do you wish providers knew, or how would you wish them to act differently in regard to their care approach to the community?
I think there's two things there too. So one is that although everybody can and should provide care to the LGBTQ community, there are a few specific things that will be helpful for providers to know. So, for example, things like basic hormone management or post-surgical management for transgender patients, things like how to take a good sexual history, and think about things like STI screening. So those things can be helpful. I also think that it's just also about how you approach or interact with people, how you relate to people, and people respond well when they feel sort of like safe and supported by a provider. So if a provider can do that, then they're usually kind of like a level above everybody else. So the other piece of advice I would have for folks that are interacting with the LGBTQ community, especially the transgender, gender nonconforming, or non-binary communities, would be to use people's pronouns that they're asking you to use the name that they're asking you to use, and to do that all the time, whether or not the patient is around you. So if you are around other healthcare providers, you want to be using the right pronoun, the right name, speaking respectfully about people, because one, because people can hear you often, but two, because we want to be respectful of our patients even when they're not there, because otherwise it's not as meaningful. So that's the kind of like the biggest sort of practical tip I can offer people, because that's one that causes a lot of stumbles, or a lot of the issues that come up in a healthcare setting have to do with just the way that we talk to or about people.
Excellent, excellent, thank you. And what has been your role, and how have you prepared yourself for your role in working to support healthcare access for folks in the community?
My role has changed a little bit over time. So when I started as a nurse practitioner about 13 years ago, it was more about sort of direct access. So I started seeing transgender patients in the community health clinic that I was located at, and then over the years that was kind of brought in to incorporate more work in larger access issues. So in my current job, for example, I work with the hospital administration to make sure that we're being compliant with all regulations and our own internal policies, and then we think about if things, situations come up where we weren't prepared or things didn't go exactly the way we wanted, we think about how can we do that better, how can we do that differently. So I think my job has kind of changed over time to include a greater kind of like meta access type thing. In terms of preparation for it, there's not a lot of clinical training about working with LGBTQ populations. I think there's probably a little more now than there was when I was in school, but not much. So a lot of that preparation I did on my own, and it is possible to, if one is motivated, to find that information. So there's a lot of conferences that are happening all the time. There's an organization called GLAMA, which is the Gay and Lesbian Medical Association. They have an annual conference, and they have a lot of resources. And then there's a lot of also many good transgender health conferences. So folks can go to the conferences, make connections, go to lectures about sort of basic management of folks, and then learn from there.
Okay, great. And last question. Any other guidance that you might offer to practitioners wishing to better prepare themselves to care for these patients?
Yeah, I think, first of all, I think we need to listen to our patients when they tell us their experiences. So if you have somebody who wants to share their experience in healthcare with you, it's really helpful if you can just kind of listen and take that in, and sort of, I think sometimes our knee-jerk response when we hear somebody's experience in healthcare, especially if it wasn't a good one, is to try to sort of like defend what happened or sort of like think about. I think we sometimes personally feel like we need to defend ourselves, and I don't think we need to do that. I think we need to just listen to people where they're at. So I think that's probably the main thing I could say.
Excellent, excellent. Well, I don't have any more questions, and I want to thank you, and I really appreciate your taking the time with me today.
You're welcome.